Assalamualaikum and hi everyone, my name is Syahirah binti Muhammad Sahardi, and today I'm going to talk about the diagnosis and treatment for the three speech disorders, which are aphasia, stuttering and mutism. Diagnosis start with a neurological examination and brain imaging such as a CT scan or MRI to locate the area of brain damage. Then, a speech-language pathologist perform a series of tests to evaluate the person's ability to name objects, repeat phrases, follow instruction, and hold conversation. Standardized tools like the Boston Diagnosis Aphasia Examination are often used to determine the types and severity of aphasia. Reading and writing abilities are also assessed to get a complete understanding of how language has been affected. Treatment for aphasia depends on the cause and the severity, but the main focus is speech and language therapy. Therapies help patients relearn lost language skills through structured exercises, word retrieval practice, and repetition. Group therapy sessions can also be very beneficial as they allow patients to practice communication in supportive social setting. In cases where speech recovery is limited, argumentative and alternative communication AAC tools are used. These can include pictures, gesture, or communication apps that help patients express themselves. Family involvement is also essential. Families are trained on how to communicate effectively. For example, by using short sentences, giving time to respond, and encouraging any form of expression. To diagnose stuttering, a speech language pathologist or SLP usually performs a detailed assessment. This includes observing the person's speech patterns, such as how often they repeat words or get stuck on sound. The SLP may also use standardized tools like the Stuttering Severity Instrument, which measure the frequency and types of disfluencies. Additionally, they will ask about family history, the age when stuttering began, and situations where it gets worse. For example, when the person is nervous or speaking in public. The evaluation also includes checking how stuttering affects the person emotionally and socially. There are two main techniques for the treatment. The first one, we have fluency shaping, which trains the person to speak more smoothly using controlled breathing and slower speech. And the next one is stuttering modification, which helps reduce fear and tension during moments of stuttering. Breathing exercises and relaxation techniques can also help. For children, parental support is very important as parents are encouraged to speak slowly and patiently, giving the child time to respond. In some cases, the therapist might also use assistive technology such as delay auditory feedback devices, which play back the speaker's voices with a slight delay to help improve the fluency. If the stuttering causes anxiety or low confidence, cognitive behavior therapy (CBT) can be helpful to address those emotional aspects. And the last one is mutism. The diagnosis of mutism involves both psychological and speech-language evaluation. A child must show a consistent inability to speak in specific situations for at least 1 month, despite being able to talk in other settings. Professionals will also make sure it's not caused by another condition like autism, hearing loss, or a language disorder. Interviews with parents and teachers are often done to understand the child behavior different environment. Observation is key. How child communicates non-verbally, such as through gesture or facial expression, give variable information. The main treatment is behavioral therapy, which gradually exposes the child to speaking situation in a safe and supportive way. For example, the therapist might first encourage the child to communicate through gesture, then whispering, and slowly progress to speaking aloud. Another effective method is cognitive behavioral therapy or CBT, which helps the child manage anxiety and build self-confidence. Speech therapy can also be used to encourage communication using games, role-play, and positive reinforcement. In addition, family therapy plays an important role, such as parents learn strategies to avoid pressuring the child and instead create a comfortable environment communication. In most severe cases, medication, particularly anxiety drugs such as SSRIs may be prescribed by a psychiatrist, but this is usually a last resort. Overall, the goal is to help child feel safe enough to speak in all situations. That's all from me. Thank you for watching my video. Hope this helped you understand more about these 3 speech disorders and the importance of communication support for those affected. Thank you so much. Bye.